Hi everybody, we're going to pick back up in your course pack, and we're on page 42 talking about diastole and systole and how that plays with the cardiac cycle. First, I should mention that the cardiac cycle is a cycle of about 0.8 seconds, and if we're talking about a cycle occurring every 0.8 seconds, doing the math, that means we're ensuring a heart rate of about 75 beats per minute. Okay, BPM meaning beats per minute there. First, let's just cover some ground conversation on these two. Diastole means relaxation. If I just simply say diastole by itself, the word itself means relaxation. If I'm more specific and I say atrial diastole, I specifically mean the atria are relaxed. If I specify that I'm in ventricular diastole, I mean that the ventricles are relaxed. But sometimes people just don't specify which chambers they're talking about, and if they simply say the word diastole, like you see here in this last bullet point, then you're to assume that someone is talking about the ventricles, not the atria. The reason is the ventricles are the main pumping or discharging chambers for the heart, and when we're talking about what they're doing, they're the most important chambers in terms of pumping blood out to the body. So by itself, the word diastole does mean relaxation, and without a modifier, atrial or ventricular in front, you're to assume that we mean ventricular diastole. In plain English, this means the ventricles are relaxed. By contrast, systole means contraction. Same story here. Atrial systole means the atria are contracting. Ventricular systole means the ventricles are contracting. And once again, if someone doesn't specify and just simply says the heart's in systole, then we're once again to assume that the ventricles are the ones that we're talking about. So ventricular systole in plain English means the ventricles are contracting. We oftentimes hear blood pressure numbers discussed when we talk about diastole and systole, and oftentimes you'll hear numbers like 120/80. We should keep in mind that there are units associated with these numbers. These blood pressure numbers are associated with millimeters mercury. That's mm for millimeters and Hg for mercury. Now, when blood pressure is taking, that is how high we can raise a column with mercury in it. So if your heart is beating strong enough to raise it to 120, that's how we get that reading, 120 over, of course, 80. Okay, so this top number here is a systolic pressure, and since I'm not specifying atria or ventricles, we're going to assume the ventricles are in systolic contractions. So systolic pressure means that when the ventricles contract, they exert a pressure of 120 millimeters mercury. Now, 120, 110, 110 is a better number. We'll talk about what good ranges are in just a moment. This lower number here is diastolic pressure, and that means, again, that the ventricles are relaxed. Keep in mind, because I did not specify ventricles or atria, you are to assume that my reference point here is the ventricle. Now, in your worksheet, you'll notice some numbers that come from the American Heart Association. The best numbers are 110/70. In recent years, the American Heart Association has lowered these numbers from 120/80. You'll notice that there are low numbers there, such as a systolic pressure that reaches as low as 80, that's called hypotension, or a diastolic number that reaches as low as 60, again, hypotension, meaning pressure that is too low. You'll also want to notice that there are pre-hypertensive numbers and then high blood pressure numbers in stages. You'll notice the number there for high blood pressure stage 1 is 140 systolic pressure and 90 diastolic pressure. So you'll want to know the normal range is around 110/70. Low blood pressure is around 80/60, and stage 1 hypertension or high blood pressure is 140/90. I'm going to focus on these two pictures to walk you through ventricular diastole and ventricular systole. You'll notice this time in the pictures they do label that we're talking about ventricles in terms of diastole and systole, so That makes us focus on their job as either relaxing or contracting. All right, so if you're with me on page 42, let's talk about mid to late ventricular diastole. That means we're going to start on the picture on the left. And during diastole, we know the ventricles are doing what? Are they relaxed or are they contracting? Well, diastole means that they are relaxed. So I'll just put in a little note here for us. All right, so right now we're looking at low pressure in the heart. We are watching blood come back into the right atrium from 3 locations, from the SVC, from the IVC, and you can't see it, but the coronary sinus has an opening right there. So I'll make a little note, coronary sinus. These 3 veins drain deoxygenated blood back into the heart. That's why it's colored blue on this right side. You'll notice the tricuspid valve is currently open, and that blood can drain down here into the right ventricle. At the very same time, the left atrium is also receiving oxygenated blood from 4 veins, but because it's oxygenated, we're going to color the blood on the left side of the heart as red. So pulmonary veins, I'll put this one here, bring blood back into the heart, into this left atrium. You'll notice that mitral valve is open and blood also drains down here into the left ventricle as well. Keep in mind that blood draining back into each ventricle is going to be under low pressure and it's done simultaneously. So right now, just take a look at your valves. AV valves, that includes tricuspid and mitral valve. They are currently open. And notice these semilunar valves right here. There's the pulmonary semilunar, and over here is your aortic semilunar. They are currently closed. So when the heart is relaxed, meaning when the ventricles are relaxed, we see blood draining under low pressure back into right atrium, right ventricle. Because the valves are open, it continues on down into the right ventricle and left ventricle respectively. So you'll notice that pressure in the heart right now on the left side is around 70 or 80 millimeters mercury pressure. And I'm going to be very specific here that is left side heart pressure. Right side heart pressure is really, really low. It's around 8 millimeters mercury. So about this time, there's a node up here in the right atrium that's going to fire off a nerve impulse. We know that is called your SA node. And what is the other name for your SA node? It's also called your pacemaker. So the SA node tells a set of chambers to contract first. Which set? Well, that would be the 2 atria. So the atria receive a nerve impulse. They begin to depolarize. They contract. And when they contract, they squeeze any remaining blood down through these open AV valves and gathers there in the 2 ventricles. Now, if we were to put a pause button on this story right now, the SA node just fired, each atrium squeezed blood down into each ventricle, we could measure the blood in each ventricle, and we would call that volume of blood in each ventricle the end diastolic volume. In each ventricle, it should be around 120 milliliters of blood. That's in each ventricle here at the end of diastole. Let me now take you to the next picture. We're going to switch to the picture on the right that's called ventricular systole. By the time that we've reached this picture, the AV node, which sits here near the base of this interventricular septum, has now received a nerve impulse that it fires down the interventricular septum and up the walls of these 2 ventricles. And of course, we know that Purkinje fibers are in the walls of these ventricles, and they will begin to fire off acetylcholine, causing the ventricle muscles to begin to depolarize and contract. Now, as they contract, they are going to pull down on the chordae tendineae that anchor these AV valves, and that will cause these AV valves to now slam shut. The closure of these AV valves creates a noise that we call a lub noise, L-U-B, lub. Now, for just a brief moment, we have not yet opened these 2 semilunar valves. So for a very brief moment, we have all 4 valves closed. And that's called the isovolumetric contraction phase. Okay, so let me repeat. When the AV node here begins to fire an impulse, The impulse travels the walls of the interventricular septum, up in the walls of the ventricles, and Purkinje fibers release acetylcholine onto these muscle cells here in the ventricles. When the ventricles begin to contract, so do the papillary muscles that stick up here into the ventricles. They pull down on these AV valves, causing them to close. What heart sound do we hear? We hear lub. Now, this is in slow motion. We have not yet opened those semilunar valves. So for right now, there's a very brief moment when all 4 valves are closed. And this is called an isovolumetric contraction phase. Okay, so let me issue this warning. There is never a time when all 4 heart valves are concurrently open, meaning there's never a time all 4 are open at the same time. But there are 2 times when all 4 heart valves are closed. This is one of them, and it's when the heart is preparing to contract. It's called isovolumetric contraction phase. Now, because these ventricles are contracting and we have high pressure building in here, and since those AV valves have now slammed shut, we have but one escape route. How is it out? We're going to exit through these semilunar valves. Blood from your right ventricle is pumped up through that pulmonary semilunar valve and up through these pulmonary trunk and these pulmonary arteries. And of course, blood leaving the left ventricle is pumped up through the aortic semilunar valve up into the aorta. And so I'll just label up here where we have the aortic arch. Now, pressure, of course, in the left ventricle here is rather high. It's around 110 to 120 millimeters mercury pressure. But pressure on the left side is actually pretty low. It's about 24 millimeters mercury. So when we talk about blood pressure, we're actually talking about which side of the heart, left side or right side. We're actually talking about left side pressures. 110 over 70 are those left side pressures. If we're talking about right side pressures, they're only 24 over 8. Wow, that's really low. That's 20% of the pressure exerted by the right side, or the left side rather. Okay, so when the heart contracts, blood is pumped up through each artery, leaving the heart, and we're looking at what's called here a stroke volume. So when blood comes up through these pulmonary arteries and out to the lungs, the blood going in this route is 70 milliliters, and that's called a stroke volume, or SV for short. Likewise, the blood traveling up through this aorta also experiences a stroke volume of 70 milliliters. So let's backtrack for just a moment. When we began this story, we had an end diastolic volume of 120 milliliters in each ventricle. Now we say that each ventricle pumps out 70 milliliters. That's called the stroke volume. Do the math. If you start with 120 milliliters and you pump out 70 milliliters, you are left behind with what's called the end systolic volume of 50 milliliters. Just subtract those, okay? So what that means is sitting here in each ventricle is an end systolic volume of 50 milliliters of blood. That's how much is left behind, okay? So that takes us over to the top of page 43, and I just want to mention to you something called ejection fraction, and we'll talk about that in just a moment. That is how efficiently your heart is pumping out blood. Notice that you don't pump out 100% of what comes in, you only pump out a portion. So let's finish this conversation. Eventually, the pressure in each ventricle decreases, and these semilunar valves here will slam shut once again. And when they slam shut, they create a noise called dup. Okay? And that dup noise comes from the closure of those semilunar valves and blood that turbulates against them. It's very important that those close, otherwise blood would backflow into the previous location. That means it would drain back into those ventricles. That would affect our ejection fraction and our ability to carry oxygenated blood, not only to the lungs, but also to the body. That's, of course, where that aorta takes that blood. Okay, so when we have the second closure here, when those semilunar valves now slam shut, we have yet another isovolumetric phase. This one is called the isovolumetric relaxation phase, and it occurs when the heart is entering its diastolic or relaxation period. Once again, all 4 valves are closed, And if we wait just a moment, those AV valves were open once more, and then we're back to the beginning of this story. We're back on the left side of this picture. Okay, so that should take us down about midway of page 43. This is a conversation that you will want to replay probably several times. If you have any questions, here again is a set of pictures, and you'll notice that in the isovolumetric contraction phase on the left, all 4 heart valves are closed. That's exactly what we expect to see. And because it's the contraction phase, we expect these ventricles down here to prepare to do what? Ventricles are preparing to contract. So we're entering into a systolic period here. Okay. Once again, isovolumetric means same volume. The volume isn't changing in the heart. All 4 heart valves are closed yet a second time, but this time the ventricles are preparing to do what? They're preparing to relax. So we're now entering once again that diastolic time period. Okay, so these pictures initially look the same because all 4 heart valves are closed, but what we have to be mindful of is, are the ventricles getting ready to contract, or are the ventricles getting ready to relax? And whatever they're getting ready to do is which phase we're in. If they're preparing to contract, we're in the isovolumetric contraction phase. However, if the ventricles are preparing to relax, we're in the isovolumetric relaxation phase. It's a good time to review here. Take a look. You have some open valves. In fact, they're the AV valves here that are open. Blood is coming into your atria, down into those ventricles. And the atria are preparing to contract. All right, so what do you think? We have atrial systole or ventricular systole? This one's atrial systole. And that's because blood is being moved from atria up here into ventricles down below. Okay, so that means the atria are preparing to contract, pump that blood down into the ventricles. What do you think's happening here? Right now you'll notice that we have closed AV valves. We have open semilunar valves. We see blood being ejected from each ventricle up through either the pulmonary trunk or the aorta. So at this picture, we're looking like we've got ventricles contracting. So what would you name this? This one is ventricular systole, meaning ventricular contraction. And you can tell that because we're looking at blood being ejected from the heart. We know that the ventricles are the discharging chambers of the heart, and they in fact are pumping blood out through their arteries. Right ventricle here pumps blood up through this pulmonary trunk and these pulmonary arteries. Okay, and then of course over here we have left ventricle, and it pumps blood up through this aorta that happens to be oxygenated blood that's going out for systemic circulation. This is a great video. You can copy and paste this URL. It gives you the relationship between diastole and systole, the heart volumes, heart pressures. So you may want to take that link and take a look at that great animation they've got. Now, I promised that we would talk a little more about ejection fraction, so it is found on the page 43 near the top. This is a measure of the heart's efficiency. So you'll notice that ejection fraction is stroke volume, or SV here, that stands for stroke volume, over EDV, and EDV is end diastolic volume. All right, so let's just look at the numbers here. What did we say stroke volume is normally? Normally 70 milliliters. And what is end diastolic volume? 120 milliliters. So let me just put this over here. If you put 70 over 120, those milliliters cancel out. And if you'll plug this into your calculator, you'll get a percentage. So I'm going to pause right now. I'm going to pull up my calculator. And we're going to say 70 divided by 120 is going to give us about 58.3%. Okay, well, that falls in our normal range down here. The normal range for ejection fraction is between 50 and 65%. So let me repeat. The ejection fraction is the efficiency of the heart. If blood comes in through end diastolic volume, around 50 to 65% of that blood should be pumped out through stroke volume. So this is a normal number. Normally if I said I'm doing good at 60%, you'd think, well, what's wrong here? But in fact, 50 to 65% is a good number. That means the heart is pumping efficiently and that what's coming in through end diastolic volume is being effectively pumped out through stroke volume. Okay, so we're looking at this as a normal range. This is a number that you will want to know for the test, okay? And anything that decreases stroke volume or end diastolic volume will decrease your ejection fraction. Likewise, anything that increases stroke volume or end diastolic volume will increase your ejection fraction. We've talked about this already, but right side pressure is much lower than left side pressure. Where does the right side of the heart send oxygenated blood, or deoxygenated blood rather? It sends it to the lungs. So we don't need incredibly high pressure traveling to the lungs. So 24/8, that pressure 24, is that systolic or diastolic pressure? That's systolic. And 8, of course, is a diastolic pressure. Okay, so right side pressure is much lower because we're only sending blood next door to the lungs. Left side pressure, however, is much higher. 110/70, 120/80, these are normal numbers. That 120 number is systolic pressure, and of course 80 is the diastolic pressure. So that is left side pressure because this is a systemic circuit, meaning blood is ejected from your left ventricle into which artery? Goes into the aorta, and the aorta takes oxygenated blood out to the entire body. So just to repeat, right side here is part of a pulmonary circuit to the lungs. Left side is a circuit that is systemic in nature, meaning it goes out to the body. So you'll notice the pressure here on the right side is much lower than what we see on the left side. Just to wrap up page 43, I wanted to talk to you about some abnormal heart sounds. These are heart valve problems. We know that heart valves close and make a lub, dup noise. And of course, the lub noise is the closure of your AV valves, and the dup noise is the closure of the semilunar valves. We believe that the noise comes from the turbulence of blood being pushed up against those valves as they close. An incompetent valve is one that does not close properly. This incompetent valve that you can see here allows blood to leak back into the previous location. So if the aortic valve is improperly closing, then into which chamber does this blood leak? It leaks back into the left ventricle. Okay, so incompetent valves are ones that allow for blood to leak. Not a good thing. That means it affects our ejection fraction. In what way? This will decrease our ejection fraction. In other words, it decreases the amount of blood being pumped out into systemic circulation. Here's a view of aortic valve stenosis. This valve right here, that's what you're looking at, and it looks narrowed. That means that blood is not able to go through as it should. So if we reduce the stroke volume, and that's of course supposed to be 70 milliliters, what impact does this have on sending oxygenated blood out into circulation? Well, that decreases the amount of blood you can circulate. That's a value we call the ejection fraction. So aortic valve stenosis means a narrowed valve, and that can cause difficulty getting oxygenated blood out into the systemic flow. Once again, here is mitral valve prolapse. This occurs when the valves, especially the mitral valve on the left side, doesn't close properly. The weakness in this valve allows for blood to flow back up into a previous location. That would be here into the left atrium. Unfortunately, that again means the amount of blood that we're pumping out through stroke volume here could also be decreased. And if stroke volume decreases, our ejection fraction may also decrease as well. That means we're not getting adequate oxygen out into those systemic circulations. So why do you think the left IV valve or mitral valve has more problems than the right one, the tricuspid valve? Well, it has to do with higher pressure over here. Pressure in this left ventricle reaches 110 to 120 during each contraction event. So that puts a lot more pressure on those valves. This tricuspid valve on the right side doesn't experience those types of high pressures. So it's all about the pressure that that valve experiences. Okay, so just a view here of mitral valve prolapse. You can see that the valves can balloon up, and that can allow for blood to leak back through. That's oftentimes what we hear in terms of a heart murmur. Okay, just another view of this mitral valve prolapse. Prolapse means to droop, and so you can see in this case the valve is not staying shut and blood can escape back up into that left atrium.